Welcome, everybody. We're going to get started in just a couple minutes. If you haven't already, I'm sure everyone is familiar with Zoom by now, but do find the chat. It's either along the bottom or the top of your screen, and that is where you can enter a question or a comment at any time throughout the night. It's also where I will be moderating the Q&A from after Dr. Kat's presentation. If you're just joining us, welcome. We're going to get started in just a minute. I'm so excited that you've taken time tonight to do this. It's our first mother-daughter event, so I'm really excited. Okay, I'll keep an eye on that. I'm going to stop sharing. And it's 5:01. Yay! One more. Welcome, everyone, to Mother and Daughter Night. My name is Shirley Weir. I'm the founder of Menopause Chicks. I have been manifesting this event for a very long time. I was going to say it's a bit of a diversion, but it's an addition to the content that we regularly host at Menopause Chicks, or often host at Menopause Chicks. If you are not already a member of the Menopause Chicks community, you can find us. We have a private online community on Facebook. And for the last few years, I have been also navigating my daughter's health journey. And so I want to share a little bit with you about that, what that's like. Some of you may be on the same path. Some of you simply may be here to gather new information so that you can prepare and be proactive. And some of you might have had these experiences that we're going to talk about tonight yourself from a personal perspective. So really, I mean, I called it Mother-Daughter Night, and then I immediately said, don't pay any attention to the title, just come. This is going to be an amazing health event for women of all ages. And I'm going to just make sure that we introduce our guest speaker right now before I get too far down the road. Dr. Kathleen Mahannah is from Restoration Health Clinic in Lynn Valley, which is in North Vancouver, British Columbia. And she is my daughter Kira's physician. So welcome, Dr. Kat.
Thank you so much for having me.
I'm just so honored that you have taken the time. I know you've invested in pulling together some amazing content for us tonight. And of course, I'm really grateful, but I want to publicly thank you for being a member of our health team and for being there with us over the last little while as Kira has been navigating PCOS. So we will learn more about that as we go forward. I'm going to do a quick check of the waiting room and just make sure that we can admit everyone who wants to be with us live. And if you're watching this on the replay, that is amazing as well. So what we're going to do, I just have a little brief introduction, then I'm going to turn over the presentation to Dr. Kat, and then we're going to open it up for Q&A at the end, and I'm going to leave lots of time for that. If you have any questions throughout the presentation, any comment or experience that you want to share, pop it into the chat. I will be moderating the chat at the end with Dr. Kat. And yeah, I don't think I have any other housekeeping. This is going to be great. Everyone knows where the washrooms are at these events, right? Just down the hall. Okay, and there's no lineup. Kira might be joining us. She might be popping in. She's working on a photography project for grade 12 today. But I have found myself over the last couple of years in an interesting position because I, first of all, come from a place of privilege. We have health benefits. I have this amazing job where I work with incredible women's health professionals every single day. They share their experience, their education, their expertise. And so that has given me a lot of confidence. And then you're faced with making health decisions alongside or for members of your family, which, let me tell you, can squash your confidence really, really quickly. So I'll back up. Both my children have been challenged with acne over the years. I have a son who's 21 this year, and Kira, probably around grade 9, started to become really concerned with her acne. And a couple of her friends at school, and this will probably not be a surprise to anyone here, decided to try the birth control pill. And not exactly my first line of defense because of what I know, but really, really hard to say no to your child who is dealing with something, sees some benefits happening with her peers and wants to try it. And so definitely we made that happen. And she was on the pill for a couple of years and decided that she wanted to stop herself. It made her have feelings of depression and anxiety. And to be honest, it really didn't do a ton with her acne. So fortunately, Kira has a family physician, a GP that she sees virtually. I don't think my kids have ever had a family doctor really since they were infants. We've been on waiting lists, and that's, a topic for another day, but part of the health model that we're all navigating. But she has an amazing relationship with her GP and a young new doctor, and she identified with Kira because of the story that Kira was telling that she potentially had 3 or more of the symptoms of PCOS, which is polycystic ovarian syndrome. I was so grateful that this doctor was on the ball, caught that, listened to my daughter tell her story, and was able to send her through the system for further investigation. So first thing was she went for an ultrasound to see if she actually had cysts, which I'll let Dr. Kat explain to us, but it's one of the potential symptoms of PCOS, and she doesn't. But she was experiencing other things: acne, facial hair, feelings of depression, and prominently, probably the most concern that got us to the doctor was irregular periods. I'm just letting 2 more people in. Welcome. Thanks for joining us. And so throughout this process, I'm really feeling grateful. I'm like, we are coming at this from a place of privilege. I understand that we are going to go through that journey. And she was quickly referred to a specialty clinic here in Vancouver. And again, I'm like, I can't believe we got in so quickly. This is amazing. That was the clinic that was going to, review her ultrasound after she, after we were investigating whether or not she had cysts on her ovaries. And I just can't believe it. And then we sit down, we get the appointment with the specialty clinic. All of this is happening at a record pace, I would say, for, some of the other health care stories that we hear. And we met with the gynecologist at this clinic, and he looked, in a matter of 2-3 minutes, he looked at her report and he looked up and said, yes, well, what you need to do is go on the birth control pill and take Accutane. And for those of you that don't know, Accutane is a very, very strong acne medication that requires, a lot of medical oversight and and side effects. And one of the side effects is depression and suicidal thoughts. And she doesn't want to be on the pill because she was on the pill and wanted to bring herself off of it. So all of a sudden, we are in this room on this computer meeting with this gynecologist, and I am trying to let my daughter, be her, navigate her own health journey. And from over at the side, I'm like, I need to step in. I need to give her the script or the language to say, you know what? That won't work for me. And so I did that. And I have, a ton of guilt because I see a naturopathic doctor for my own health. And I didn't set her on that journey for her own. I got kind of caught up in the, oh, we're so lucky, we're going down this path and all will be well, right? Because you really want to have a positive outlook as you were going through this. So then we met with Dr. Kat, and that has really been an amazing journey. I was so proud of my daughter, the way she told her story, her health history. And I said to her as we left her first appointment, I said, I am so sorry that we didn't do this sooner. And Kira said, oh, that's okay, Mom. I wasn't ready to make the nutritional changes and the lifestyle changes, but I am now. And so that was almost a year ago, I think. And that's how long I've been manifesting this event tonight. And I tried to do that introduction and tell that story. It's kind of the first time I've done it, A, without crying, and B, as quickly as I can, because I want to turn over the mic to our very special guest tonight, Kira's doctor, Dr. Kathleen Mahannah, and you are in for a lot of education tonight. These are big buckets, big subjects that I have asked her to tackle. We are only going to be able to skim the surface, but I think it's really important, whether, like I said, you're being proactive in your learning or reactive or somewhere in between, that we raise awareness with our mothers and our daughters, so that we can have more conversations about this. My experience led to a conversation at the side of the soccer pitch, which led to tonight's event. Yours might be something different. Maybe it's someone that you work with who might be able to take advantage of your learning tonight. Whatever it is, this is an incredible opportunity to raise awareness. And again, I want to thank you for taking the time tonight to put your own name at the top of the to-do list and carving out time for this information. So it is my pleasure to turn the microphone over to Dr. Kat.
Thank you so much, Shirley. And thank you for sharing that story. It's just so wonderful to hear. And I love when moms come in with their daughters to really assist them on that journey, stepping into womanhood and taking on that power for themselves. So being that role model for your daughter and for all women to take on that role is really, really incredible. I'm going to take a moment here to share my screen so I can walk you through some slides. All right. Well, everyone, thank you so much for being here. And thank you, Shirley, for having me. My name is Dr. Kathleen Mahannah. I go by Dr. Kat. And as Shirley said, I'm a naturopathic doctor. I practice in North Vancouver, British Columbia. And my background is in exercise science. I studied kinesiology, and then I studied naturopathic medicine for 4 years. And ever since I graduated and opened up my practice doors, I focused my practice almost exclusively in women's health and hormones. And I work with women all across the lifespan, from young girls and teens to women all the way through menopause. So today, I am going to walk you through some of the P's in a woman's life. And like Shirley said, I'm going to skim the top off many of these. I could spend a whole hour talking about each of these slides. So I'm going to give you some snippets, and we'll have lots of time for Q&A at the end. Okay, so I want to start with periods. And I want to have a conversation about what is considered healthy and normal for girls and women. And I touch on this because, for so many of us, girls and women, we learn from our peers or from our moms what is considered normal. And sometimes if, I have patients who will come in and say, well, my mom had super heavy, crazy periods, so that's how mine are too. And as if that's normal or something that they should just be able to put up with. When in fact, if we can educate and support women and girls in understanding what's normal and optimal and what kind of symptoms require some extra attention. So I want to start with bleeding patterns. So what is considered normal and healthy for a period is a period about once a month. So between 21 to 35 days, that's the normal range, more optimally somewhere in the closer range of 25 to 32-ish days. Now, for teen girls who have just recently got a period, or those, 1 to 3 years after getting their first period, that's a time of, it's normal to have irregular or unpredictable cycles during that time. That's a time when the brain and the ovaries are learning how to communicate with one another effectively. So that would be a time period where more erratic periods or unusual period timing is considered normal. Now, that doesn't mean that there's still lots we can do to support those periods and make them more manageable, which I'll touch on in a minute. So a period should come about once a month. It should last between 3 to 7 days, 7 days at most. It should not be longer than that. And in terms of how much blood a woman should be losing, this is important because so many women don't realize how heavy their periods are. What's considered normal is about the range of between 2 tablespoons to up to no more than 6 tablespoons of blood lost per period, not per day, per period. So to put this more simply, what does this actually look like? If a woman or a girl are soaking through a menstrual product, tampon or pad, or filling up a Diva cup every 2 hours, that's a heavy period. And that is something that needs to be looked at more closely. For one, that woman or girl is losing a lot of blood and therefore is probably iron deficient, which we can detect in a simple blood test. And 2, we also want to understand, why are they having heavy periods? And that's where sometimes women or girls get stopped. They go to their doctor and they have these heavy periods. They might be told to start taking iron, but it doesn't really go much further than that. In those cases, sometimes women are offered the pill. And I'm going to talk about the pill in a few minutes here. But the question that I want to just leave you with here is, what is the cause of this heavy period? And that's where a lot of women will land in my office. So we can actually do a bit more of a deep dive on why that period might be so heavy. Heavy periods can be a result of thyroid issues. It can be a result of hormone issues. It could be clotting issues, and lots of things that could cause those heavy periods. Now, I also want to touch here on pain and painful cramps. While cramping pain is common, it's not normal. And I want to be very specific about this. So if a girl or woman is experiencing some cramps, that can be in the range of normal, as long as it's not impacting her ability to go to school or play in sports, or it's not debilitating her in any way. So this is another common one where women will say, well, my mom had super heavy and painful periods, so this is just how it is for me. But again, this is something that we want to look at more closely. So in my practice, I'll do a lot of work with patients in looking more closely at specific nutrition patterns, or looking at specific herbs or nutrients that we can employ to help to mitigate those period cramps that are still in the range of common or normal. And I want to highlight here the difference between painful cramps and a more severe pain condition called endometriosis. For those of you who haven't heard of endometriosis, this is a inflammatory pain condition that occurs in girls and women that presents as extremely debilitating, painful periods. So this can look like, girls or women who have a hard time getting out of bed. They might feel nauseous. They may actually vomit. They have a hard time going to school. Advil isn't doing the trick, and it's really impacting their ability to participate in sports or other activities. It can also present as low back pain or pain being referred down the legs. Sometimes it can present as painful bowel movements around the period. So briefly, endometriosis, what this is some of that endometrial tissue, that inner uterine lining tissue, instead of being all located within the uterus, it actually implants in other areas in the pelvic wall. And that tissue responds to the cyclic nature of hormones and causes that inflammation and pain. I mention this because endometriosis is incredibly common. 1 in 10 women have endometriosis. The average length of time to be diagnosed with endometriosis is 7 years. So a lot of times women will show up to their doctor's office and say, I have these really painful periods. And they may be told, okay, we'll take Advil, or here's naproxen, or here's another anti-inflammatory medication. And with endometriosis, that often does not do the trick. Endometriosis is challenging to properly diagnose because it requires a laparoscopic surgery to actually go in and see that tissue for a proper diagnosis. But what I do in my office is, again, when I have patients who come in who have that extremely debilitating, painful cramps, I treat them presumptively for endometriosis. And I talk to them about, nutrition and anti-inflammatory support and other means of mitigating that pain while we help to direct them to the proper team to diagnose and take care of that endometriosis. I'll leave it at that for now. If you have more questions, we can chat more about that. Now, going back to periods, a couple last things I want to say about this is it is so incredibly empowering for girls and women to learn how to track their periods and their cycles. I think that level of self-awareness and developing that skill of observing your body and becoming familiar with your period and your changes in hormones is so empowering both for girls and for women later on. I love recommending cycle tracking apps for teens and younger women. The app Flow is wonderful. There's lots of education that happens during each phase of the cycle on that particular app. Or Kindara is my other favorite one for tracking your period, tracking PMS symptoms or ovulation or other types of aspects of your cycle. These days, there are so many amazing period products. The Diva Cup or other menstrual cups are very popular. I also just wanted to note some of the period underwear products. I think they're amazing. And especially for girls or women who might be dealing with heavier periods or issues about being embarrassed about leaks or, anything like that, the period underwear from brands like Thinx or there's another one that starts with a K that I'm blanking on right now. Knix underwear. They're amazing. So both for girls and women, highly recommend those. And lastly, when it comes to support, as Shirley kind of outlined in her story, similar for any type of period problem, if you or your daughter go to your doctor and you're given a solution to a period problem that you just don't feel comfortable with, or you have more questions about, or you want to learn more about what your other options are, take the next step. And, naturopathic doctors, who have a focus in women's health are very well positioned to have more well-rounded conversations with you about what all your options are, whether that's medication or supplements or nutrition or acupuncture or other things to help to identify the root cause of that period problem and really help to take care of it. PMS, premenstrual syndrome. So incredibly common. 95% of women will experience PMS at some point in their lifetime. So that is an incredibly high number. And there's so many different factors that contribute to PMS. Now, how does this present? Many of you may know or have experienced this. PMS can range from fluctuations in your mood, from anxiety to depression or irritability in those 2 to 7 days before the period starts. It can also include other physical changes like breast tenderness or bloating or water retention, to name only a few. Sleep disturbances is another common one. There's a lot of different factors that contributes to PMS symptoms, and I'll touch on just a couple here. First and foremost is actually nutrition. There was a study that was done looking at women who had severe PMS compared to women who had no PMS at all. And when they analyzed their diets, they found that women who had more severe PMS ate 275% more refined sugar and carbohydrates compared to those women who did not have PMS. Those women with PMS also ate significantly less zinc and iron and other specific nutrients that help with hormone balance. So sometimes with my patients, the very first thing I'll do for PMS is prescribe a green smoothie every single day to get that really good dose of those micronutrients that help with mood and help with hormones. Other factors that influence PMS, one is sleep. Being chronically sleep deprived can worsen your PMS symptoms. Stress is a big one. Anyone during this past year, during the pandemic, experienced higher levels of stress and maybe higher levels of PMS symptoms? Yes, me too. So stress is a really big contributor to worsen PMS symptoms. Now here, I also want to elaborate more on what is an acceptable level of PMS versus when to seek more support. Now, a little bit of symptoms before your period is normal. If you feel tired, if you feel a bit run down or feel more introverted or have like a little bit of breast tenderness, maybe a little bit of more moodiness, that's all within the realm of manageable for you. That's considered, mild. If you are experiencing more severe symptoms like 7 days of really not feeling like yourself or feeling extremely anxious and that's becoming debilitating, that's also a time for us to have a further conversation, with a naturopathic doctor or with your healthcare provider to look at that more closely. And I see lots of this in my practice. And again, as I alluded to, there's so much we can do from a nutrition and herbal perspective to really balance and support PMS symptoms. Now, there's also a more severe form of PMS, which is called premenstrual dysmorphic disorder, or PMDD. Now, PMDD is a pattern of mood disturbance that occurs for the 2 weeks before the period starts that involves severe anxiety and or depression that is debilitating and impacts a woman's ability to go to school or work or impacts her relationships. Now, in PMDD, we don't know exactly what is going on. It's a mix of the drop off of the hormones that are associated with a very severe drop off of serotonin, which is our happy hormone or happy neurotransmitter. So in women with PMDD, this is quite severe and debilitating. And this only occurs in about 1 to 5% of women, so much lower rates compared to PMS. So if you or your daughter seem to be exhibiting those more serious or lengthy periods of PMS symptoms, I certainly recommend speaking with your healthcare provider to get more of a sense of, is this something that requires a referral or more support for addressing something like PMDD? Now, PMDD or those mood disturbances, those can come alongside or mask or present like other mental health concerns. So again, if you have any concerns in this realm, sooner rather than later is the right time to speak with a healthcare professional about that. So when it comes to supporting PMS or PMDD, but I'll speak to PMS here, I alluded to the nutrition piece. That's the first thing that I audit with my patients very closely. I look at the quality of the fruits and vegetables that they're getting. I look at the quality of the grains, how much protein they're getting, whether they're actually eating at regular intervals throughout the day, because supporting blood sugar can actually support PMS symptoms. We also look very closely at how we can support physical activity. Studies show that being physically active, even with walking or easy jogging during that second half of the cycle, can help to mitigate PMS symptoms. In my practice, I use a lot of herbal medicine. One of my top favorite herbs I prescribe to my patients is called chaste tree. And chaste tree has been shown to be as effective as some types of antidepressants in the treatment of PMS symptoms. So really, really powerful how herbs can impact and support hormones and PMS. Okay, PCOS, polycystic ovarian syndrome. So I treat a lot of this in my practice, and PCOS is the most common hormone and metabolic syndrome in women. This is very common, and it can take women a while to be diagnosed depending on how her body is presenting with those symptoms. Now, PCOS, this is a syndrome that involves elevated testosterone levels, disrupted ovulation, irregular periods, and disrupted insulin signaling. That's our blood sugar hormone. PCOS can present with something as mild as a little bit of acne, or it could be other elevated testosterone symptoms like hair growth on the face or on the chest or on the belly. It can present with irregular menstrual cycles, so periods that come less frequently than every 35 days. Or it can present as no periods whatsoever, so the period can actually disappear in PCOS. So when women present with any of those symptoms, the first thing that we do to work this up is we start with some blood testing. In blood testing, I'm going to just summarize this very briefly, but we're looking at the hormones and specifically testosterone. The next step is referring women for a pelvic ultrasound, so we can actually look at the size and shape of the ovaries to see if we can see those polycystic ovaries. Now, for a diagnosis of PCOS, all you need is signs of elevated testosterone, so acne or excess hair growth, irregular or absent periods, polycystic ovaries, or a blood test that shows elevated testosterone. If you have 2 of those 4, that makes the diagnosis of PCOS. Now, here's a thing that, Shirley really highlighted or was highlighting with this, and that I really want to drive home is there's a few implications with PCOS. One is, yes, the bothersome symptoms, of course, the acne for sure, especially for teens, absolutely, and for women in their 30s and 40s and beyond too. The second is their irregular periods. And then the third, but lesser addressed, is the implications for blood sugar and metabolism. So what happens often is a doctor will often say, okay, let's put you on the pill to control your periods and control your acne. And while that can be a Band-Aid solution for mitigating those concerns, it can make the acne go away in some cases. It can regulate the cycle so that women bleed regularly. It doesn't actually address the root cause of PCOS, which is related to that insulin signaling. So what happens in 10 years if that woman decides that she wants to have a family, she comes off the pill, do all those symptoms come back? Yes, they do. So this is why I spend a lot of time really teaching women about how we can treat that root cause of PCOS. So there's lots of things that I can talk about here, but what I want to just briefly touch on is the goals of treating PCOS are to help a woman's cycle come back regularly, at least once a month, or once a month, I should say, supporting their insulin levels and blood sugar, which we can accomplish a lot through nutrition, and supporting their hormones. So those are the main goals. Now, these goals might change throughout a woman's life. In a woman who decides that she wants to have a family, and if she has PCOS, if she's not ovulating regularly, then we need to target her specific support to make sure that she's ovulating regularly and optimize her chance of having a successful pregnancy. Now, PCOS also affects women in perimenopause and menopause. So even in menopause, after your period disappears, the insulin and metabolic implications are still there. So this is why even for my patients in their 50s, even when they retire from having a period, we still need to manage that PCOS. And again, there's lots we can do from a nutrition standpoint and with some specific targeted nutrients. One thing I'll highlight at this point is a test that's often missed in women with PCOS is vitamin D testing. Vitamin D is often deficient in women with PCOS. And when we correct and optimize those vitamin D levels, that really helps with PCOS outcomes. So that's just one of the additional tests I like to screen with my patients. I also look more closely at blood sugar and insulin, for example. Okay. All right, the pill. So for starters, I think that the pill was one of the greatest things that happened to the women's movement in the 60s and 70s. There are lots of different pill options out there. The concern I have these days about the pill is whether it's being used for truly its contraceptive purposes, and if it's chosen with that informed consent after reviewing all the options and understanding the risks and benefits, versus is the pill being given as a treatment or a Band-Aid solution to a hormone concern. I'll delve more into that in a second. Now, the pill is quite an effective means of preventing pregnancies. When it's used perfectly, it's 99.7% effective in preventing pregnancies. Now, we want to look more closely at typical use, because typical use is, we're all human. Sometimes we forget or skip a day or, don't take it at the same time. So when it's used typically, the effectiveness rate is closer to 92%. So that's just something for you to know, or your daughters to know, in terms of when you're thinking about this option for contraception, that's how effective it is. Briefly, I'll compare that to the IUD, which is another popular option that I see a lot in my practice. The IUD is great because you set it and forget it. And once it's there, it's 99% effective in preventing pregnancies. You don't have to worry about perfect use or not, or forgetting. It's just there. So I won't elaborate too much on all the different options just for sake of time. Again, I could talk about this a lot. But what I want to delve more into are the things to think about and be aware of as you're deciding upon the type of contraception that you want to use, or if you're using the pill as a treatment for a hormone concern. So there are some well-known side effects of the pill, and family doctors and healthcare practitioners do a pretty good job of screening for these. So there is a small risk of stroke or clots or high blood pressure or heart attacks with the pill. It's incredibly small though. And for those women who don't have any risk factors, like a history of heart attacks, or if they're not smokers, or if they don't have untreated high blood pressure, the risk is incredibly small. The risk goes from about 1 in a million to 3 in a million for those concerning side effects. Now, other side effects of the pill that are much more common, but not talked about very much, especially when you're discussing these options with your family doctor. This is what I want to highlight for you right now. So other side effects of the pill. Number one, more studies are demonstrating that the pill can actually decrease bone density in women later in life. I'm particularly concerned about this for teens and young women who get put on the pill at an early age. We actually lay down the majority of our bones before the age of 25. So for young girls and young women who are put on the pill and are on it for 5-10 years, they're missing a really key time in their life to build that good, healthy bone that sets them up for health later in life. So just one thing to be aware of as you're making those decisions. Number two, the pill can deplete some of your nutrients. So, and this can be pretty easily mitigated by taking a multivitamin or a B vitamin. The pill can cause headaches and migraines. I have one patient who was having 10 migraines a month. When she came off the pill, she went down to 1 migraine a month. The pill can also decrease libido, and more studies are coming out now about this, showing that the pill or other hormone contraception can decrease libido and cause vaginal dryness. The pill also can contribute to depression and anxiety. There was one massive study done in the last few years, a Dutch study of over 1 million women, which found that hormone contraception significantly increased a woman's chance of being diagnosed with depression and going on antidepressants. What's concerning about this is that this was even more true for teens, for teen girls. One follow-up study showed that women taking hormonal birth control had triple the risk of suicide. So for our, teens and young women who might be struggling with mental health concerns anyways, just being cautious, or, thinking carefully about decision to start the pill or what your other options might be. Depression can come up quickly or it can come up very slowly. The problem is that when women are depressed, they tend to blame themselves as opposed to really evaluating the medications that they're on. So I just want to highlight that. Other side effects, the pill can sensitize women to stress, so they feel stress more acutely. It can contribute to weight gain and water retention. It can contribute to hair loss and can worsen spotting or bloating or nausea in some patients. So what I want you to take home from this particular side is what exactly is true informed consent? Informed consent is a discussion with your healthcare provider that involves discussing the treatment option, in this case, the pill, what the benefits and risks are, what your alternative options may be, and answering any questions that you may have. So some things that I encourage women to ask with their healthcare providers are there side effects to this treatment? Are there any long-term or short-term risks? Are there any other options available for managing my hormones or concern? Or even just simply saying, I need to think about this. Is there more information that I can read to learn more as I make my decision? And lastly, I always encourage women to ask, are there any other doctors or specialists or healthcare providers that I can see who could assist me on my healthcare journey? And Shirley really outlined that really well in her story. And, what I love about what I do is, as a naturopathic doctor, I really help to fill in the gaps in some of the conventional care. So often a woman will come to me and say, my doctor gave me this, but I don't know why. And I'll just sit down and explain to them the reasons why and outline what it means and what else we can do to help with their healthcare concern. I'll touch on this very briefly, PAP exam. So in British Columbia, where I practice, the recommendations these days are starting PAPs at the age of 25. And if those PAPs are normal, we only need to do them every 3 years. And that gets bumped up to every 6 months if a woman has a result that comes back that indicates any abnormal cells. So if anyone has questions about that, certainly pop them into the chat, but I'll just breeze through this one. Preconception. This is one of my favorite P's for women. I love when women come in and are starting to think about getting pregnant and are asking questions about how they can prepare themselves and their bodies for this very special time. I usually tell my patients to come see me 3 to 6 months before they're starting to think about trying to conceive. During this time, we will do a thorough health checkup, including some nutrient status testing, checking their hormones, checking out their menstrual cycle, looking at their nutrition. We'll do an audit of their home and skincare products to get rid of any hormone disrupting chemicals. We'll do some teaching and education about understanding the fertile window and the signs of ovulation. And this is particularly powerful for women who have been on the pill or other hormone contraceptive for years. Women will come off and say, I haven't ovulated in 10 years. And I don't even know what that's like or when that happens. And so to really help a woman rediscover her hormones and her fertility it's such an exciting time of life. There's also so much that we can do to really optimize a woman's health, to optimize her healthy pregnancy and her chances of getting pregnant. So this is a great time for women to start tracking their cycle if they haven't already, using an app like I mentioned. This process also involves partners. It takes two, right, for this journey. So I often recommend that women have their partners come in for their own health checkup. This is a family event to grow a family. And so we can establish some healthy nutrition and dietary patterns and have a good health checkup at this early stage that really bodes well for the family's health. So if a woman has a male partner, we'll do a similar audit of their health. And if it's a same-sex partner, same thing, we'll audit their health and have a further discussion about how we optimize their health and fertility in preparation for assisted reproductive technology. Now, pregnancies. So I am a really big advocate for a woman having a strong healthcare team around her at every stage of her life. That includes, of course, your family doctor, a naturopathic doctor. That could be your massage therapist, your chiropractor, your therapist. I really feel that women deserve that really strong care team around them. I've had some patients come in and they kind of laugh sheepishly and will say, here I am. I've seen so many doctors. Here I'm seeing you now. And I say, yes, as you should. You should have this team of people around you who are taking care of you. And pregnancy is no exception to this. So a lot of women will work with an obstetrician or a midwife as their primary care taker during this time. But oftentimes women have a lot of further questions or concerns that come up between their visits, which sometimes are few and far between, especially in the early stages of pregnancy. So this is where I come in as a naturopathic doctor. I meet with women all along their the different stages of pregnancy to help with answering their questions about nutrition, what to eat, tackling any of those pregnancy symptoms, whether it's nausea or heartburn or fatigue. I help them interpret their blood test results. Sometimes I'm running additional blood tests to help to optimize their health and check in on their thyroid or iron. Also, if any pregnancy conditions do arise, I'll use the example of gestational diabetes, again, quite common for women. I'll have patients come in and we do a very thorough, again, audit on their diet and nutrition to help to optimize their outcomes and support their health, again, at every stage of pregnancy, no matter what's coming up for them. I do a lot of labor preparation. So I do acupuncture in my practice to help women prepare for labor in those final stages of pregnancy. So that's all I'll touch on for now with pregnancy. Again, I'm happy to answer any questions that you have about that. And perimenopause. And if you are here as part of the Menopause Chicks, I know you have a wealth of amazing information at your fingertips. I love when I have new patients come in who have been through the Menopause Checks. They are just so well equipped with a strong foundation of knowledge and understanding as to what's happening in their body. And that really allows us to hit the ground running in supporting their health. So once again, this is a time of life where a woman really deserves to have that really thorough care team. And where a naturopathic doctor falls into this, I do a lot of hormone testing, health evaluation, assessing metabolism, answering questions about how we can optimize and support metabolism as hormones are shifting and changing. Of course, I predominantly work in natural medicine, ranging from herbal medicine to acupuncture to nutrition, but I also prescribe bioidentical hormones as well. As a naturopathic doctor in British Columbia, I'm able to prescribe medicine, and BHRT is a big part of my practice when I work with patients in perimenopause. So again, I'm happy to answer any questions that you have about perimenopause, but I know you probably have a really good foundation of knowledge if you're here today. Lastly, just wrapping up here, I just want to highlight a couple offerings that I have these days. In my practice, I do see patients one-on-one, and I have also started offering online programs. I made one recently earlier this year for women who are coming off the birth control pill and are navigating rediscovering their menstrual cycles and balancing their hormones. In this program, I teach all about rediscovering your cycle, addressing PMS, learning about the other hormones that impact your cycle, and figuring out your fertility. So I have more information that's going to be coming soon about this one. And as a thank you for being here. Did I include this slide? I hope I did. I maybe missed it. As part of a thank you for being here tonight, if you pop over to my website, which is down here at the bottom, I have a hormone quiz, which looks at the 3 most common patterns of hormone imbalance for women in anywhere from teens up until the 40s. So this is a great tool for daughters or for anyone listening to understand more about those different hormone patterns that can arise. I will also have, oh, here's my extra info I had available about contraception. I also have programs coming later this year for women navigating perimenopause. So if you hop onto my mailing list or follow me on Instagram, you'll see more information coming about that. So this concludes this part of the presentation. Thanks for sticking with me through a whole bunch of information. I hope that was useful to start to perk your interests on some of these areas, and I would be happy to answer any questions that you may have.
Thank you so much, Dr. Kat. I know that that's a lot, and it's like 50 minutes into this event already. So we're going to just dive right in. I do have one question about PCOS from someone who's watching with her daughter. And I'm wondering if you can expand a little bit, or I can expand a little bit on treatment options for PCOS. I don't believe that I mentioned in the introduction the journey that Kira chose, in addition to addressing her nutrition and taking care of some nutritional deficiencies such as was iron. That was part of her plan, but she's also she chose spirolactin, which is a medication, and she is leveraging the opportunity to use progesterone to have a regular cycle. Can you augment that?
Yeah, absolutely. Okay, so when it comes to PCOS, in thinking about the goals, one of the primary goals for medical doctors is to make sure that women are having a bleed at least once every 3 months. And so that is often accomplished by offering the pill. There are other options as well. So cyclic progesterone therapy is another option. The pill is the most common one that is offered. Now, other concerns that arise in PCOS, I alluded to concerns with blood sugar or insulin. For women who do have elevated insulin or blood sugar or may have prediabetes as part of their PCOS picture, from a medical standpoint, they're often recommended a medication called metformin, which is a diabetes medication that helps to control insulin signaling. So that's one option that may be offered. There are other versions of those types of medication, so that might be on the table too. Now, from a naturopathic standpoint, I'll expand on this a little bit more. There's so much that we can accomplish through diet and lifestyle to help to support PCOS and the insulin piece. For example, supporting nutrition by really ensuring a woman's getting adequate protein from, chicken or fish or beans, legumes, lentils. So really upping the protein, moderating the amount of carbs that she's having. So really focusing on the healthy whole grains like quinoa and rice and vegetables, and decreasing some of the refined carbohydrates that come from baked goods or refined white flour. That makes a big difference for the blood sugar piece. And then also making sure that a woman's getting good quality fats. So healthy fats from olive oil and nuts and seeds, just as a few examples. So the nutrition piece goes a long way. There's also some specific supplements that have been shown to be very effective in supporting PCOS. One example that I'll give is a B vitamin derivative called inositol. And inositol helps with insulin signaling. So this is a common one that I discuss in great detail with my patients. I alluded to vitamin D testing, and then ensuring those D levels are adequate. That's another important piece. So those are a few of the things that we'll start to tackle from a naturopathic standpoint. Depending on a woman's PCOS, there can be some other anti-androgen medications to help with acne symptoms, predominantly, and spironolactone is one of those, probably one of the more common ones that's used. So those are some of the broad outlines of the families of directions that we can go with treating PCOS. Now this will vary for a woman later in her life when she's might be trying to get pregnant. Then that protocol will shift and change a lot based on her needs and goals at that point in time. But what I really want to leave people with is, again, understand all your options medically and asking the questions, how else can I support my insulin or blood sugar or hormones? The last piece that I haven't mentioned yet is exercise and movement. That makes a big difference in insulin signaling too. Studies show that for women who have PCOS, maintaining a healthy body weight really works wonders in supporting PCOS too. So that can be accomplished by the nutrition pieces that we talked about and being physically active. So I hope that answered that question.
It's an amazing answer. I do want to thank you too. In your presentation, you talked about making decisions over the course of a lifespan. And, often it is us, the moms, who are like, oh my gosh, I'm making a decision for my daughter's future fertility. That can be really overwhelming. And if that's the case, reach out. There are resources for health advocates, those of us who are, trying to steer our daughters towards good quality information and education as well. We all need that kind of support. I have a couple questions for you from a 20-year-old. So first one is, how can someone in their 20s with secondary, I can't even know if I can say this, Amenorrhea.
Amenorrhea.
Yeah, thank you. Deal with night sweats.
Okay. So, one question I would ask is, why is this secondary amenorrhea occurring? And that could be against, hopefully this person has done some additional testing to understand that. Polycystic ovarian syndrome is an example of secondary amenorrhea, or, sometimes if a woman, another example is you think of the high performance athlete who's training really hard and her period disappears. That's another example of secondary amenorrhea. So number one is we want to understand the root cause. What is the root cause of that? So that'd be my first piece. And then secondly, with night sweats, yeah, that's a good question. One thing that I do as a naturopathic doctor is, tap into the power of herbal medicine. And there are some specific herbs and, again, nutrients that can be supportive for night sweats. As an example, black cohosh is a good one for that. Fish oils can help with that. But again, I'm really curious as to why that's occurring. Another hormone imbalance that comes to mind for night sweats is checking the thyroid.
Yeah.
If the thyroid isn't functioning optimally, if it's any changes there, then those need to be addressed. And no herb is going to work if it's not tackling the correct problem. So if it's a thyroid issue, then herbs won't really help with that. We have to address the thyroid. So those would be some of the starting points to kind of point you in some directions as to where to start getting some testing or continue down the path of testing to understand the question as to why that's occurring.
Yeah, search for the root cause. A great reminder for everyone who's listening and watching this too is check your thyroid anyway, because in the work that we do at Menopause Chicks, too often we have women who are experiencing things and they might be chalking it up to perimenopause or menopause, and it could be your thyroid imbalance, which is like super important that you're checking. The second question, we heard you mention that PCOS, that weight gain can be one of the signals for PCOS, but can it cause weight loss as well?
Good question. That would be quite rare because typically what happens is when our body isn't responding to insulin as it should be, that can contribute to the weight gain piece. So if a woman has, or a girl has PCOS and she's losing weight that's unexpected or is not intentionally trying to lose weight, there might be something else going on that could be contributing to that. So it wouldn't be the first thing that I would think of with PCOS.
So worth investigating again for what the root cause is there. Okay, we're going to switch gears a little bit to someone in perimenopause who just stopped taking the birth control pill. She was on it for 20 years. And like you mentioned, her bones and muscles feel weak and achy, and she's looking for a strategy for how to navigate the next phase.
Yeah, absolutely. Yeah. And like so many women who've been on the pill for 10, 20 years or more, and like a lot can shift and change when you come off that, especially during perimenopause. So a few things that come to mind, some specific nutrients that help with muscles. Number one is protein. The majority of women are not getting adequate protein to fuel their basic needs for muscle health and metabolism. So what I tell women is, quick and dirty way of figuring out how much protein you actually need is, we're Canadian, so I'm going to do kilograms. So convert your weight in pounds to kilograms. Do it on Google. That's what I do. And then that number, that's how many grams of protein you should be getting every day.
That's a good tip.
Yeah. Yeah. So start there. My first tip would be look at how much protein you're actually getting. And, what I do is with my patients, I'll have them audit their diet and just track their diet on an app for 3 days and look at the total amount of protein that they're getting to see if they're even reaching that, minimum amount of protein. So that'd be the first thing. Number two is, one nutrient, an additional nutrient is magnesium. Magnesium is really wonderful for helping to shuttle water back into cells and help with muscle recovery. So that'd be a second thing. And then third thing, resistance training. So incredibly important for women all across the lifespan, but particularly in the 30s and 40s and beyond, for women to actually maintain their muscle mass and prevent the loss of muscle over the years. resistance training and weight training is really critical alongside getting adequate protein to protect that muscle mass over time. So those would be the couple of things that I would point this person towards to help with those achy muscles. Good old-fashioned hot bath with some Epsom salts, that helps too.
Awesome. I love this question because we're like backing up to, I guess 4 to 6 years ago when Kira first got her period. So this question is coming from her mom. Her daughter just got her period and she's experiencing acne.
Mhm.
What are some steps or options worth exploring?
Yeah, great question. So yes, acne during puberty is so incredibly common, and that's a result of hormones coming online, including some of those androgens, which is a normal part of puberty. Now, is this, we've been talking about PCOS, and acne is not necessarily part of PCOS, but it can be. So it's one thing to have on your radar. Now, earlier things that you can do, I always start with, my teen girls with the nutrition piece. So I'll prescribe a green smoothie with a couple big handfuls of kale and half a banana and some antioxidant rich berries and a good scoop of protein powder, just to ensure that they're getting some of the basic nutrients that help with skin health. Number 2 is zinc. Often people who have acne are deficient in zinc, so that can be a basic starting point. Of course, also there's all the wonderful topical options. From a common one that doctors might recommend is a benzoyl peroxide, which helps with the spot treatment, but it doesn't really help with preventing the acne. I love recommending soaps that have, or face washes that have tea tree in it. Tea tree is a herb that's very antimicrobial and helps with killing off the acne that contributes to, the bacteria that contributes to acne. So those would be the places that I would start. So really good skincare routine to help with getting rid of some of that bacteria, ensuring that a teen is really getting adequate nutrition, replacing some of the sugary sweets and snacks with more protein rich or, fibers. That does make a difference. From a dietary perspective, the 2 biggest food triggers or contributing factors for acne that I see in my practice are sugar and dairy. Mm-hmm. So just some things to be aware of with that. So often the sugar piece is one that I help coach patients to kind of, how can we replace this with some like fruits and instead of the sugary sweets. So those would be some of the starting places that I would direct them towards.
Thank you. I hope that's helpful. Dr. Kat, can you speak to the word normal? So we have someone who's, said that she did have her thyroid test and apparently it was normal. And then, that I talk a lot about iron deficiency, and there's a lot of women in our community who've been told their iron is normal. So please explain.
Yes, that's a great question. So the definition of normal from a medical standpoint is they're looking to see, do you have an overt disease or pathology? So that's where the cutoff numbers generally come from. Are you so deficient in iron that you are fully anemic? Or is your thyroid hormone in a place that you overtly have hypothyroidism? Now, from the perspective of the healthcare system, bless them. They want to, they want to identify the right people to treat them ASAP. But for the people who fall within the realm of suboptimal, from a medical standpoint, that's not a concern for those medical doctors. And that's where, again, working with a naturopathic doctor can be so useful, is because I want to look at not just, are you disease-free, but are you optimal? So that range of normal and healthy is a lot more narrow from my perspective and in my definition. So I'll take the example of thyroid. So the general test for thyroid is called TSH, thyroid stimulating hormone. And in Canada or BC, the range of normal is approximately 0.5 to about 5. And if you fall outside that range, then doctors will do some further testing to understand what's going on. But if you're at 4.5 and you fall inside the normal range, that's definitely not optimal. Optimal from a thyroid perspective for me is between 1 and 2.5. So I have a very narrow definition of what I consider optimal thyroid function. So yes, I have lots of women who come into my office and will say exactly that. I was told that my thyroid is normal. And I'll say, can I see those labs? Let me look myself, and we'll have a closer look and see if you were normal or if you were optimal. And if you're not optimal, let's get you there.
It's An excellent answer. And to remind everyone too, I mean, how are you feeling? Right? So are you feeling and I don't even like the word normal, I try not to use it, but are you feeling your optimal best? Because to have someone tell you that your labs are normal, it quickly sends a message to our brains and to our daughter's brains. Oh, there must be something wrong with me. It must be all in my head. I must be making this up. I must be the only one. None of those things that I have just said are true. You didn't make it up. So it's worth that further investigation and to find out what's optimal for you.
Absolutely. Yeah, well said.
Soapbox. Sorry. What's the fastest way to balance your hormones after coming off the pill?
That's a great question. So the first thing I would say is in those cases, I recommend getting some testing done. We talk about testing a lot. I'm a big fan of like really looking at what is going on inside. So we want to actually understand if you are come off the pill and suddenly you're feeling off, then we want to understand specifically what is going on there. Is it just perimenopause? Is it also iron deficiency? Is it thyroid? What else is going on? So we want to be thorough with that. The fastest way of balancing hormones after getting, okay, well, again, lots of directions I could go with this. I'm going to go with the fastest answer, which is probably thinking about oral micronized progesterone. It's I always have this conversation with my perimenopause patients as one of their, again, options for perimenopause, whether now or later, or maybe never, but just so they're aware of that option. Progesterone just works so incredibly well to help with balancing hormones and supporting sleep and mitigating PMS symptoms and normalizing the period and getting rid of or reducing the heavy period. So that'd probably be the fastest way. I would also say the other things that we want to take care of again are the thorough testing, looking at your vitamin D levels, reassessing your nutrition, looking at how are you sleeping. That's such a key one. I have my own soapbox about sleep quality for perimenopausal women, and how can we optimize all those things. But progesterone, as the short answer, would be where I'd probably go.
Yeah, I mean, and get informed and build your health team, and choose the journey that's right for you. And, Dr. Kat is, this isn't the equivalent. If you sit down and book an appointment with Dr. Kat, like you're getting, an hour of personalized, individual consultation and a personalized health plan. So that is a quick answer, but we're being very general here as well. And I think, my answer to that question would be get informed, build your health team, choose the journey that's right for you. And then peeling back the layers of the onion on that getting informed piece for me on my perimenopause journey was learning the impact of stress. Which then leads to sleep and nutrition and lifestyle and all those things that I still need like lots of reminders for. It's never a job that's 100% complete. Okay, what are some of the pros and cons of spirolactone? And
so I'm just reading through the rest of that question there. What issues am I having due to PCOS? Do you have any recommendations for hormone medication that won't get rid of facial hair? Okay, so pros and cons of spironolactone. So what spironolactone does is it blocks the conversion of testosterone to dihydrotestosterone. So helps with some of the testosterone symptoms like acne or possibly hair growth. It can work well in some people for those things. Possible side effects, it can cause spotting or irregular periods. It can sometimes cause dizziness or faintness or changes in blood pressure. Those are the first few things that come to mind. So the question about how we support, so I guess the question that I would have is, what is the goal of that spironolactone? So if it's to mitigate some of the concerns, for example, perhaps acne, there are other options that can help to support with acne that won't impact things like the change in the facial hair. So as something I mentioned earlier was the inositol supplement.
Yeah.
That can be really great for supporting blood sugar and insulin and also helps with skin. The other common PCOS medications that help with hormones, there's the pill and then the androgen one. So I think that most of those could impact the facial hair piece. So you might look at the supplements, like I said, or then there's the piece around metformin and the blood sugar and the insulin angle. So those would be some things to consider with your healthcare providers.
Yeah, and you can't get pregnant while you're on.
Yes. Yeah, good point. Exactly. So women who are on, or people who are on spironolactone are advised to take some form of contraception because the spironolactone can affect the health of a fetus. So that you're right. That's another important one.
And Kira really enjoyed inositol. So we were introduced to inositol by you. So is that something for all women, or is that a specific protocol for women with or individuals battling PCOS?
Yeah, so inositol is a recommendation I have for my patients, all my PCOS patients at every phase of life.
Okay.
I equate it to, it's like a multivitamin. It's like a PCOS person's multivitamin.
Okay, great.
Yeah. Mm-hmm.
Okay, okay, so getting back to iron, because we did just kind of touch briefly on that and about normal. So this guess ferritin levels, what is the optimal range? Mine was 40 and they said it was fine.
Mm-hmm. Yeah. So I ideally like to see ferritin closer to 70. That generally helps with hair quality, which a lot of women have concerns about. If there's any thinning of the hair, we want to look at supporting iron levels. So generally, I look at 70 if there's any hair concerns. Kind of 50 would be kind of a minimum, ideally. Most women in my office typically come in between like 5 and 25, usually quite low. Yeah.
Wow. And so how are you feeling at 5 to 25?
Exactly. Really run down, tired, short of breath, unusual shortness of breath that's going up a hill or upstairs, fatigued, hair falling out, maybe associated with suboptimal thyroid function, achiness, restless legs.
Wow, that's quite a list.
Yeah.
And does depression or anxiety fit into that at all?
Yeah. So that fatigue or feeling super run down, that can feel like depression in iron deficiency. Anxiety could be a part and parcel with iron deficiency. I don't see that one as often. It's probably more like the fatigued, run down, depressed kind of end of the spectrum, at least in my experience.
Yeah, we have a lot of work to do in that area because it is almost like somebody handed a placard sign to women and said, expect to feel exhausted. And then we just like grab that sign and carry it with us through I know we have some university students here tonight, so burning the candle at both ends, and then, entering the workforce and maybe having a family. And then all of a sudden, like, you're like, oh my gosh, I've been iron deficient for decades.
Mm-hmm. Absolutely. Yeah. And so especially with any period concerns or heavy periods, it's the first thing that I'm having women check and monitor that every 3 to 6 months to make sure it's increasing as you would expect it to with proper supplementation.
I think that with your note on protein is super key, because I know I'm not getting enough protein, right?
Mm-hmm. Yeah.
And just the health benefits, and we sometimes forget, right?
Yep.
To put that. Yep. Any other questions? Oh, we have a very helpful, thank you for this amazing event. Does anybody have any other questions? We'll stick around for a few more minutes. I am so grateful to you for tackling this invitation to join us. I really, really appreciate because, just a wealth of information, super important topics. And I believe we have just maybe lifted the lid on some of these for menopause chicks and for the mothers and daughters in our group. If we were to go just quickly the other way, so thinking about our own mothers or grandmothers, even, what are some messages or conversations that you'd like to see us starting with women older than us?
Yeah, that's such a great question. Yeah, and very similar things like how are you feeling? Like how are you really? And let's do some of the similar tests for those women too. Is there any issues with thyroid there? Looking closely at nutrition. I really want to drive home the point around the protein and exercise and movement, especially for women, 60, 70 and beyond. I think one of the, biggest things we can provide for women at that time of life is supporting them with maintaining their independence, which
Yes.
comes from really ensuring that they've good strong muscles that will help with their balance, that nutrition that will support their mental health and mood, and really I think in this day and age with everything going on, just connecting. Yeah,
Yeah.
as a family and as friends. Yeah.
I love that independence piece. We kind of push it aside or maybe sweep it under the carpet. I have a girlfriend who, she's a regular gym attendee. I applaud her so much, but she says, Shirley, I don't do squats to fit into my jeans. I do squats because I want to use the toilet unattended when I'm older.
Yep.
And it's just such, it's so refreshing and inspiring to hear those paradigm shifts, because so many things can spring out from that. Bone health,
Absolutely.
independence, like you mentioned, having your vitamin D checked, right?
Absolutely. And even that sense of, I think a lot of women are so pleasantly surprised to discover how strong they feel when they do start that, workouts or resistance training. That's a really incredibly satisfying and empowering feeling too.
Right. Which feeds our confidence
Yeah,
bucket,
absolutely.
right? And fills it up. Well, I want to again thank you for all the work and effort that you put into your presentation tonight. You can find Dr. Kat at restorationhealthclinic.ca, and she can see anyone in British Columbia virtually if you live in BC. And I want to thank you, everyone who showed up tonight, to put yourself and your daughter's health at the top of your to-do list. And if you're watching this replay, thank you for taking the time, and everyone will receive the replay tomorrow. You're welcome to watch, rewatch, and share with your friends and the women in your life that you love. So thanks again. Have a great
Thank you
night,
so
everybody.
much. Bye, everyone.